Students, today we'll be discussing about the neuroanatomy of the spinal cord. So in adults, we can say the length of the spinal cord is around 45 centimeters, and the extent of the spinal cord is from the upper border of C2 to lower border of L1. Okay, so below L1 we don't have the spinal cord. So here we can see the spinal cord. Okay, and you can see the coverings of the spinal cord. This is the dura mater, what you are seeing here. Okay, and you can see that the spinal cord is the continuation of the medulla oblongata. So here it continues all the way down from the foramen magnum downwards. Okay, so here it ends as a dilatation called as the conus medullaris. So here you can see that it is cone shaped. Okay, so here it is actually ending. So this is at the level of the lower border of L1. From here downwards we have the subarachnoid space. So here the spinal cord is ending, and these are the covering of the spinal cord. So we will discuss about the coverings of the spinal cord and the enlargements. So here you can see the cervical enlargement. Two enlargements are there in the spinal cord. One at the region of the cervical region. Okay, so this is extending from C3 to T2. Okay, so why this is happening? This is because of the brachial plexus and voluntary movements taking place in the upper limb. So you have one bulge here. Another bulge will be in the lumbar region. That is because you have the lumbar plexus here. So you have the two enlargement. One is cervical, another is lumbar. So the lumbar extends from L1 to S3. So you have two bulges. One is cervical bulge, another is lumbar bulge or enlargement. Then we are coming to the coverings of the spinal cord. Here also it's a continuation of whatever coverings are there in the brain. That is the dura mater, the arachnoid mater, and the pia mater. So what you are seeing here is the dura mater. Okay, so this is the dura mater. So this dura mater is different from the dura mater what is covering the brain. In the brain, you remember you had the meningeal layer and the endosteal layer. So here there will be a space outside the dura also, that we call it as epidural space, which is very important because it contains, we have what is called as Batson venous plexus, and little fat is there. Okay, so that is for epidural anesthesia while during the labor or in obstetrician use, we use the epidural space. Then we have the arachnoid mater, which is not seen because it is very thin. Then we have the pia mater. Between the pia mater and the arachnoid mater, you have the subarachnoid space, which is filled with CSF. Okay, so CSF will be there. Okay, large bulge of CSF will be there, which we call it as lumbar cistern. So there you do the lumbar puncture, usually done at the level of L3, L4. Now coming to the modifications of the pia mater, you have 21 pairs of tooth-shaped projections called as ligamentum denticulatum. You can see here these are triangular fibrous folds extending from the pia mater, okay, towards the dura mater. So you have 21 pairs of these triangular folds on either sides, and one more you have the linea splendens, which is present on the anterior median sulcus. Okay, and another is the filum terminale. The filum terminale is a fibrous cord which is extending from the terminal end of the conus medullaris. So you can see the conus medullaris here, and this is the fibrous cord. So totally we have three modifications. One is filum terminale, another is the ligamentum denticulatum, another is linea spendens on the anterior median fissure. So these are the three modifications of the pia mater. So you need to remember about the epidural space and the subarachnoid space. Subarachnoid space mainly for doing the lumbar puncture, which is usually done between L3 and L4 for diagnostic and therapeutic purpose. So here you can see whole bulge of the spinal nerves. So 31 pairs of spinal nerves you have emerging from the anterolateral fissure and posterolateral fissures. So you can see this anterolateral, these are the ventral rami, and posteriorly you will have the dorsal rami. These are the motor fibers, these are the sensory fibers. All of them you can see converge, look like the tail of a horse. So that's why we call it as cauda equina. Anterior median fissure. Okay, so this is again divided into anterolateral and posterolateral on the posterior aspect. From the anterolateral you have the anterior rami coming out. Okay, anterior rami, these are the motor fibers, and posteriorly on the posterolateral fissure you have the sensory fibers or the dorsal root. This goes to form the dorsal root ganglion on this side. Okay, so this is the anterior ventral rami, and this is the anterior rami coming from the anterolateral fissure, and here you can see the dorsal rami coming from the posterolateral fissure. Okay, so this is the anteromedian fissure. So you can see the arteries here. Okay, so when you see this, this is the anterior spinal artery. Okay, this pierces the linea splendens to supply the spinal cord anteriorly. So you have the anterior spinal artery, then you have two pairs of posterior spinal arteries, and you have the radicular arteries. So all these are branches coming from directly from the vertebral artery. So this is about the blood supply of the spinal cord. So you can see the anterior spinal artery. Similar to this, you will have the two posterior spinal arteries on the posterior aspect. So that's about the blood supply of the spinal cord. So here you have the cauda equina. So you 31 pairs of spinal nerves all coming out here. Okay, so this is the conus medullaris, and this is the cauda equina. It resembles the horse tail, that's why we call it as cauda equina. And the fibrous cord, which is the continuation of the conus medullaris, is nothing but the phylum terminal. So this is a modification of the pia mater. This cauda equina consists of the fibers coming from mainly from the lumbar segments and the sacral segments and the coccygeal segments. So totally you will have the 31 segments of the spinal cord. Okay, so 8, that is C8, T12, okay, T5, then L5 and S5 and C1. Okay, so this is the cauda equina. So the points that you should remember is with regards to the lumbar puncture, which you usually do at the level of L3, L4 for diagnostic and therapeutic purpose. And you should remember about the epidural space, which is present just above the dura mater, directly related to the vertebral column here. So that contains the Batson plexus. That is also the applied aspect of it is mainly for giving epidural anesthesia in obstetric use, and also for giving some medications. Okay, and lumbar puncture, you should remember to take out the CSF for pathological analysis for various, to detect various anomalies as well as various pathological conditions. So these are the two important things that you should remember with regards to the spaces. So one is epidural space, another is the subarachnoid space.